This is a demonstration of how to perform oral care on an unconscious patient. You would also do this with the patient who's lethargic or who has an aspiration risk. The supplies that you'll need is a towel, a washcloth, mouthwash, some water, oral swabs, an emesis basin, a tongue depressor wrapped with gauze, and 2 cups. Remember your critical criteria of safety, infection control, resident rights, and reporting any abnormalities. Okay, so you're going to do your beginning procedures, wash your hands, get your gloves and get your supplies, knock on the door, come in, introduce yourself. I'm Amber, I'm your nurse today. We're going to be performing oral care. Identify the patient, the wristband. Remember to always talk to a patient even if they are unconscious, because they may be able to hear you. You're going to raise the side rail on the opposite side that you're working. Provide privacy, so remember to pull your curtain. There's a couple different positions that you may place the patient in during this procedure. The patient can be supine with their head turned towards you. They can be in a lateral position, so turn towards you, and then you put pillows behind their back to support them while they're in that position and still turn their head. And then we can also elevate the head of the bed just a bit. Remember, they're unconscious. And then we would also turn their head. Okay. You're going to place the towel underneath their chin to protect their clothing. You need to verbalize at this state that you would perform oral care on an unconscious person every 2 hours. You can do it more often than this, but at least 2 hours. You're going to get your supplies ready, so you get your mouthwash, and then you're going to dilute it with water. So you want to go 50-50. Then you're just going to get a glass of water for rinsing. You may place the basin underneath the neck if you would like to. It's optional. You use the tongue depressor to depress the lower lip down when you're performing the skill so that you can use the swabs to clean out the mouth. Never stick your fingers in the patient's mouth. So I'm going to get my swab. Dip it in your mouthwash and water. Bring the swab out. Remember, any extra fluid may go straight to the lungs, causing aspiration or pneumonia, possibly death. Okay? You're going to swab the surface of the mouth, the upper gums or teeth. Remember, you're not using toothpaste or a toothbrush. You're just swabbing. You're going to throw it away. Get another one. And you're going to do the lower teeth or gums. Throw it away. Look inside the mouth. Make sure there's no abnormalities such as thrush that's on the tongue. That's a yeast infection, or bleeding gums, or chipped teeth. Any abnormalities. Okay, throw this away. Okay. Then you're going to repeat the process with rinse water. So all surfaces of the mouth, throw it away. Okay, once you have done that, you're going to get your washcloth. You're going to wipe down the lips and note any abnormalities, cracked lips. If they do have cracked lips, then you can put some lip balm on them If they are on oxygen, you have to use a water-based lubricant because petroleum is flammable. Roll the linen away from you, away from the patient, and place it in the linen barrel. You want to place the patient's head back where it was. Make sure they're in good alignment. Okay, and we're going to perform any procedures. We always take care of our patient first. So I'm going to take off my gloves and throw them away. Then I'm going to lower the bed, give them the call light, telephone and water in reach. You're going to open up the curtains, and now I need to care for my equipment. So I would get on more gloves and take care of my equipment. Once I was done with that, then I'd go get the visitors if the patient had any, let them know they may return, report, and document any abnormalities.